and welcome to Urology Unplugged, the podcast that simplifies the urological health for everyone. I'm your host, Dr. Vaishali Gosavi, and today we are exploring a topic that's lesser known but has a significant impact on quality of life, urethral stricture. Joining us, a true expert in the field, Dr. Sandesh Surana, a renowned urologist with over 25 years of experience. Dr. Surana is associated with Pune Hospital and Research Center and Sanjeevan Hospital, and he is known for his empathetic approach and precise diagnosis. Dr. Surana, welcome to the show. It's a pleasure to have you here.
Thank you, Dr. Vaishali. It's a pleasure to be here with you and share my knowledge about stricture urethra and also help the listener to understand this particular problem.
Let's start with the basics, sir. What exactly is urethral stricture and why is it important for the people to know about it?
Right. See, before knowing the urethral stricture, we should know what is the urethra. So, urethra is a urinary tube which carries the urine from bladder and it throws out of the body.
Okay.
So, around in males, around 20 centimeter length of the urethra, in females is around 4 to 5 centimeter. So, when there is a narrowing in this particular passage in the tube, it is called stricture urethra.
Okay.
Why it is important? Because if it is untreated or if it is ignored, it can land up into life-threatening complications like bladder damage, urinary tract infection, kidney infection, and sometimes stone formation also.
Okay.
So, knowing the disease is very important. We should know what is the stricture disease, and you should aware of this problem because early diagnosis can can prevent the life-threatening complications.
Okay. So, doctor, what typically causes urethral stricture, and are there specific risk factors people should be aware of?
There are so many causes of urethral stricture, mainly the trauma. Trauma means external trauma like in road traffic accidents. The urethra, the urinary tube, is attached to the pelvic bone, and if you got your pelvic fractured due to some accident, then this urinary tube gets damaged and stricture can occur post-traumatic.
Okay.
The other reason may be the urinary infection or sexually transmitted diseases. Sometimes this problem can be congenital, and the other main cause is the skin disease, which is called lichen sclerosis.
Okay.
That is BXO, balanitis xenotic obliterans, which can affect the urethra and cause stricture disease.
Okay.
These are the main risk factors and causes of the stricture disease.
Okay. So, what symptoms should people watch out for, and when should they consult a urologist?
Correct. See, whenever there is a problem in the urethra or whenever there is a stricture urethra, the patient will complain of poor urinary flow. He will go frequently for urination. He will get up in the night multiple times. He will get burning in urination, which is called urinary infection, dysuria. Sometimes he will feel that some urine is retaining inside the bladder. He is not emptying his bladder properly.
Okay.
He can get pain in the lower abdomen. So these are the various symptoms of this disease. And if you have problem, if you have any problem of this, you can consult your urologist.
Okay, got it. So let's tackle some myths about urethral stricture. I'll share statement, and you tell us whether it's a myth or fact. Okay. The first one is urethral stricture only happen in older men?
No. See, this is the myth. This disease can affect any age group, right from children to very old person also.
Okay.
The common age group is young age group, and it can affect any age group where the trauma is common, whereas urinary infection is common.
Okay.
It can be congenital. So it is not that it is occurs only in old age. It can happen at any age, and it has to be investigated and treated properly.
Okay. Another myth is that surgery is the only option for the urethral stricture. Is it so?
Yes, correct. Actually, speaking, There is one more problem with the prostate. See, prostate has a medicine. It has some tablets available. But the problem with the stricture is there is no medicine available. So almost all stricture disease needs a surgical treatment, either in the form of endoscopic surgery or open surgery.
Okay.
But it's true that it needs a surgery.
Okay, so fact myths. Okay. And the third myth is that urethral stricture is a rare condition?
Not at all.
Oh.
See, stricture is very common disease, but most of them what happen, it is ignored, or most of the patient doesn't come to us with the stricture disease. They come when their kidney gets fired, they get infection. Actually. They came in the late stage. So it is a very common disease, and people should know about it, and they should consult their doctor and get treated as early as possible.
Oh, means less awareness and stuff, right? So what advancements in diagnosis and treatment for urethral stricture are giving hope to the patients today?
There are 3-4 important tests or investigations available to diagnose the stricture disease. The most important is the uroflowmetry. In this test, what happens, we ask patient to pass urine in a particular electronic commode, and the result, the graph will come, and according to the graph, we can diagnose whether patient has stricture or it is a normal flow.
Okay.
Normal urinary flow is around 15 ml per second. If patient has stricture, his flow must be 7 or 8 ml, almost half of the normal flow.
Okay.
So this is the most important test, which is a office-based, non-invasive test, easily available. Report will come in within 2 minutes.
Okay.
The another important test is a X-ray of the urinary passage. We call it a RGU, that is a retrograde urethrogram.
Okay.
In this test, we pass a solution in the urinary passage and take the X-rays. And whenever there is a stricture, there will be a narrowing of the urinary passage. So this is the most important, very specific diagnostic test is RGU.
Okay.
Another most important test is urethroscopy. We can put the scope inside the urethra and see where the stricture is. So these 3 are important tests to know the stricture disease. At the same time, we get all sonography of this patient to confirm our diagnosis, to know the kidney status. We should know the what is the bladder, how is the bladder wall thickness. Is patient is retaining some urine after urination. So sonography also helps to support the diagnosis.
Okay. So, sir, let's make it little interesting now. Do you have any story for our listeners in your practice which will illustrate the impact of early diagnosis and treatment?
Yeah, there are many stories actually available. I came across. One of my patient is 55 years old. He has a urinary problem since long time, but he thought it is aging. So he didn't show any doctor, and he came directly with the urinary infection, swollen kidney, raised creatinine.
Okay.
We have done his test. We diagnosed his stricture disease. We have done his endoscopy, and his creatinine was normal. His kidney started functioning, and he is absolutely all right. Okay. So early diagnosis, early intervention is very important for this disease.
True that. So, what proactive steps can our listeners take to reduce their risk of urethral stricture or manage their symptoms better?
See, risk factors as such is not there, but we know the causes of this stricture disease. There is trauma.
Okay.
So there is a road traffic accident. So if you drive safely, you will not have any accident, and you can you don't have any problem with the urethra then.
Yes.
The second thing is urine infection. If you have a multiple partners, multiple sex contact, then use protection so that you will not get any infection, and this problem can be avoided. The other is drink lot of water, keep hydrated. Yes. And that is the most important key part. So as such, there is no risk factor, but you can try to avoid this problem with these maneuvers.
Absolutely. So here's a question from listener actually. Is there any chance of urethral stricture to recur after treatment?
Yes, there is a high chance of recurrence in this stricture disease if you treat the disease with the endoscopy. The endoscopic treatment for this particular problem has success rate only 10%. Okay. 90% will get recurrence. The only gold standard treatment for this stricture is buccal mucosa erythroplasty. Means what we do, see, there is a narrowing in the urinary passage.
Yes.
So what we do, we take the buccal mucosa, means skin inside from the cheek, and make this tube wide.
Okay.
That is the best way to treat this problem, to tackle this problem, and success rate goes to 90-95%.
Okay.
So the best way to handle or treat this stricture is erythroplasty, using some skin like buccal mucosa.
Sir, as we wrap up, what's one key takeaway you would like to our listeners to remember about urethral stricture?
The most important thing I want to tell my listeners that if you have a problem, consult your doctor as early as possible. Because see, urethral disease is not a cancer. It is a simple benign disease which is treatable. But if you ignore, if you don't treat this patient, it will land him in a life-threatening complications like kidney dysfunction, bladder dysfunction, repeated urinary tract infections. Yeah. So most important part is that this is a manageable disease. This is not a cancer, it is a benign disease. Okay. So early diagnosis, early intervention.
Thank you, Dr. Surana, for sharing your expertise and shedding light on important topic.
Thank you. It has been a pleasure to be here with you and throw some light on this disease and share knowledge to raise the awareness of this problem.
And thank you to our listeners for tuning in to Urology Unplugged. If you found this episode helpful, share it with your family and friends. And do not forget to subscribe for more expert conversation on men's and urological health. Until next time, take care and stay proactive about your health. Thank you.